everyone, I hope you're all doing well out there. The United States has a much higher rate in men who have HIV infection, by about 76% over women. Same would be true for Canada. I described my own personal HIV symptoms in a couple of my videos in detail. That would be my acute HIV symptoms answered and my HIV symptoms pre-diagnosis. Now I want to share in general what you may experience. First up, in case you didn't know, HIV is a virus that attacks your own body's immune system, destroying a specific type of cell that helps the body fight off infections and diseases. Generally, women have the same symptoms as men. Early HIV symptoms are usually bearable and can be mistaken for a flu or a minor health condition. This can happen as early as a few days to a couple of weeks after exposure to the virus. I get a lot of people surprised by this. I have not experienced all of these symptoms, but certainly some. You may experience fever, skin rash, headaches, tiredness, and sore throat. I also want to be clear that you may not experience any symptoms at all. Besides flu-like symptoms, men may experience more severe symptoms like dementia, weight loss, and extreme fatigue. I was quite surprised that dementia was in there. I thought it would have been later on if you progressed to AIDS. Less common early HIV symptoms are ulcers in your mouth, ulcers on your genitals, night sweats, nausea and vomiting, sore muscles, joint pain, and swollen lymph nodes. Men have a tendency not to see a doctor or put it off. This could worsen the risk of an advanced infection. HIV progresses in 3 stages, being the first, the acute phase. Usually this occurs between 2 and 4 weeks after exposure to the virus. At this time, the person would have a high amount of virus in the bloodstream and a greater chance to pass it on to others. Stage 2, clinical latency. This could last for 10 years or more. If the person does not seek treatment and have no symptoms, the virus is still multiplying in your body, but the rates aren't as high as in the acute phase. Now the dreaded stage 3, AIDS. Obviously the most severe. At this point, the virus has depleted your body's own immune system and have great risk to disease and infections. The common side effects would be fever, sweats, chills, weight loss, weakness, swollen lymph nodes, and skin lesions. Even if you reach stage 3, you could reverse course with treatment, although you may have lingering health issues. In the United States, in Canada, and elsewhere around the world, most people do not reach to the point of AIDS because they have treatment of ART. CDC recommends people to get tested at least once a year, and higher risk groups such as gay and bisexual men who have sex with men, and drug injection users. Also, anyone who has unprotected sex should get tested regularly. For both men and women, spotting the symptoms and getting diagnosed right away in treatment can lessen or eliminate the risk of passing it on to another person. Remember, U equals U, undetectable equals untransmittable. I hope you enjoyed this video. Please like and subscribe if you haven't already. Tap that notification bell. Until next time, Michael K here. Take care, everyone.